So in this video, we're going to talk about soft tissue mobilization as well as stretching of the diaphragm, okay? So with our diaphragm, it's one of the stranger muscles in our body, right? But it's a wonderful muscle that we should all be using. So in the relaxed state, right, we should have this doming of our diaphragm, and when we breathe, it should actually contract, and then that central tendon should pull down, right, to then relatively mobilize all of our viscera down towards our pelvis or pelvic floor, okay? If we don't use our diaphragm, or if our diaphragm's over tight and we can't access it, then we're not going to be able to develop the intra-abdominal pressure that we need to develop, and we're going to end up with all this accessory breathing that goes up into our neck area, okay? So what we want to check with this is there a soft tissue component of restriction that's not allowing us to access our diaphragm as well as we should? If there is, we need to work on that, and then after getting the muscles to relax, then we may need to work on getting that diaphragm to overall lengthen so that it can go from sitting in this position to sitting more in this dome-like resting position, okay? So on Kelsey, I'm just going to see, the first thing I noticed on her is that she has a rib flare bilaterally. That doesn't necessarily mean that her diaphragm is going to be totally relaxed, so we need to check it anyway, okay? So as I come, I kind of place my hands, okay with me here, kind of place my hands so that I can round my fingers around the border of her ribs, and I just want to feel, as I round, is there any area that feels restricted? And right here, underneath my manual contact here, is where there's restriction, okay? So I want to work on that. So I'm just sinking into that restriction, and I'm feeling, using my cascade of techniques, where the hardest infill is, okay? And now I am kind of sinking in with 2 fingers, and then it feels like I just kind of want to pull that apart. And then I'll probably have her breathe into that restriction, okay? Because we're on a muscle that is most effectively utilized with breath. So go ahead and breathe in for me, Kelsey. And then I want a long, slow exhale, okay? Because we want to facilitate that diaphragm to relax and go into that dome that we were talking about. Good, and breathe in again. And out. And I'm just angling my manual contact basically towards the ribs and up towards her head. And again. Good, long, slow exhale. Good, I'm just following the release of that muscle, okay? So, and you can check all along that lower border of the rib cage to see if you find any amount of restriction. And then after you feel like you've loosened that up a little bit, you know, this area doesn't really feel like it needs much of a stretch, but if I can sink in a little bit more laterally here, then I can get on a good little purchase that has a bit of a hard infill. And now go ahead and breathe in, Kelsey, and I can pull up as she breathes in, and then as she breathes out, in order to stretch that, she's going to breathe all the way out, and I'm maintaining my contact pulling up so that as she breathes out, that central tendon's taking everything up. I'm holding the ribs here, so we're getting a nice elongation with that exhale. That can be confusing for a lot of people. Go ahead and breathe in. So I'm following that. And then as she breathes out, I'm maintaining that position. She needs to breathe all the way out though. I feel like a lot of therapists will have them breathe out and just let them do this shallow breath. If they do a shallow breath, they're not getting full elongation of the diaphragm, okay? So this is soft tissue mobilization and stretch of the diaphragm.